All right, now I'm going to go over the education tab. This is something that we've talked about. I think we all know that family education and education is very important. Joint Commission is really going to harp on that. And it's something that I think we do day in and day out, but charting it is a different story. And like we all know, if you didn't chart it, it didn't happen. So um, let's go ahead and we'll click on this education tab real quick. I don't know if you guys, if you don't have it up here or if you don't see it where you want, where it's easily visible and you won't forget about it, there's this customize button right here that you can actually move things around. So let's say work list was up here and you don't hardly ever use that. You can kind of pull that down all the way to the bottom. I kind of set it up for, all right, my flow sheets and my MAR are the big ones, and let's say I don't want to forget my education, I can click this button and make that a big tab as well. And so, those are the ones that you really want to focus on, and you can bring and take out, take down here, things like that. So once it looks how you want, you hit accept, and it'll look that way. Um, so what's nice is um, Renee Brett actually worked pretty hard in trying to get this education tab working for respiratory. Um, and so if you click on this tab, it looks kind of blank and intimidating, but all you have to do is click this add title at the bottom, um, and you can add a new title. And if we put in respiratory, oh God, I can't spell respiratory. There we go. And then if you click this whole book, it'll click everything. All right. Now, do we always need everything? No. Let's say the patient just got put on topramycin, and you kind of went over some things with them, how the nebulizer works, what the topramycin's for, things like that. You can just click nebulizer, and this is kind of the description of what it's going to be. It's going to talk to them about small volume neb, why we use it, how to clean it, blah, blah, all the things that we talk about, but we never really chart. So what's nice is rather than typing all this out, which none of us want to do, all you have to do is click buttons, and I'll kind of go over more of that in a second. So, but for this instance, I'm just going to click all of them and click accept. Um, and so what this does is it enables us to document on each of these and appropriately and completely. So, for instance, let's do suctioning. Okay. Once you click there, the gray is just kind of overall what you're going to be teaching. The operation of the device, how to suction orally or with a catheter, when to suction, what to look for, pre-oxygenation, lavage, and if you use it, how you use it, troubleshooting options. Okay, it's very in depth, and all you have to do is you click document, this bottom right corner. Um, and that brings in the four big boxes. Anything with a box, more than one. So say you taught the patient and the family. Method, did you explain and demonstrate? Did you use a handout? Did you use a video? What did you do? So we'll just say explained and demonstrated. Response, did they understand? Did they show that they understood? Did they refuse teaching and tell you to get out of the room? What happened? So we'll say here that they demonstrated understanding, or actually we'll say they demonstrated understanding and they're accepting of it. They were ready. And here you can obviously add anything extra that you want to. You can say life involved um, seemed or whatever. It doesn't have to be in depth. Obviously, you've already kind of said everything already with these check boxes and with the description, but you can say anything else extra in here if you want. Then once you click file, boom, it locks it. And you see a little green check mark, shows that it was done. Um, and the nice thing about this is that you can kind of go back through. Let's say this was me, and then let's say somebody else comes over and they try to teach the family, they try to demonstrate and explain it, but this person really showed no evidence of learning. They were not accepting, and this was the sister. Sister, very hesitant. and you go through, you file that, and so you can kind of go through and you can click more, and it says, and it kind of shows, oh, um, what happened, who was it with, um, and and then once you as you can see, once you needed more work on it, it had this little green line rather than a check line. But and what's nice is that I've kind of started creating um, something that mimics this as far as a bedside checklist, so that all of us are on the same page: respiratory, family, MDs, everything. So this mimics exactly what mimics the Epic, and we can just check the boxes. So as a team, we can decide, hey, how many times should we observe? Should we just let them see us do it, versus use assistant, then perform on their own, and then they check it off then they sign off if they're comfortable with the process. This is something that's really gonna help us in the long run, as far as it protects us as providers, saying, hey, you didn't teach this person. We can come back and say, yeah, we did. See, look. And obviously, this is a bedside flow sheet that is just for easy to follow. Everything else needs to be done in Epic, and this is a quick and easy way that when you check this box, say, you want to make sure you go in here and follow it up with a quick documentation. So, and I think the more comfortable we come with it, the easier it'll become. Why didn't that work? Demonstrate acceptance, family, explanation. There we go. And now it's a green checkbox. And then let's say that's all we're going to teach them. Boom, ready to go. We can resolve it. And um, oh, I guess you resolved the whole thing. But so let's say that they're not going to use any secretion devices. This can be acapella or whatever. All you have to do is mark this checkbox, say not applicable, boom, and it grays it out. Let's say we don't need these two, we can just delete them and say data entry error, we put them in by accident, didn't need them, delete those. And then the cool thing about this is, let's say cough assist device, or there's not on there, but we want to talk about it. We can add a point. It says select a new point from the search box. So this is if we wanted to find one new point, say about Foley or anything like that. But mostly, if you just check all those boxes that I talked to you about, that's all we need. Anything else, you can say, I want my own point. You add your point. What's the name of your point? And you can say cough assist device. You go in here. What kind of description? And again, this is something you want to kind of be a little more wordy here than you would in other places, because this is going to be your full description. So you could say they use ordered settings, frequency, and troubleshooting of the cough assist device. Now, is this going to be something that's rare? Probably. I mean, most of the time we should be able to just go through our settings. So select the title you want it to be under. So we want it to be under respiratory education, and then that'll highlight accept. Boom, you click it, and boom, it comes under just like everything else. So, and that's about it. I think if we start, it's obviously going to be something new, but start playing with it, start getting comfortable with it, see how it works. Like I said, this is going to protect us, because if we can kind of go back and say, we documented fully, and they demonstrated and everything, especially with our patients that are going home with vent care. This is going to be a lot easier than going to our notes and clicking in here. Nope, I erased the education one, but if we, rather than trying to type out everything and going back and searching, okay, who did what, who did where, we can just I can go ahead and create a template that just says, see Epic Education tab for details. And that saves us from having to chart more than once. That's automatically in there. It reminds us to go, oops, we got to go back and make sure we do our education tab. But that sets the standard. So let me know what you guys think, and any tips or troubleshooting things. All right, thanks.